Stand by for a provincial COVID-19 update.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, February the 8th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. The next 3 days, Tuesday, Wednesday, and Thursday, we'll be providing written reports at 3 o'clock with the latest information about the COVID-19 pandemic in BC. And then on Friday, we'll be providing an in-person briefing at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today, being Monday, we're reporting for 3 reporting periods. And I do think I have the dates right this week. Starting February 5th to 6th, Friday to Saturday, we had 428 new cases diagnosed with COVID-19 in BC. February 6th to 7th, an additional 465 new cases were diagnosed, and in the last 24 hours, 343 additional cases, bringing the total number of new cases over the weekend to 1,236, 5 of whom which were epidemiologically linked cases. And that brings our total in British Columbia to 70,952 people who've been diagnosed with COVID-19. Of the new cases, 266 were people in the Vancouver Coastal Health Region, 601 in the Fraser Health Region, 86 people were on Vancouver Island, 152 people in the Interior Health Region, and 131 people in the Northern Health Region. Today we have 3,976 active cases in all areas of British Columbia, and of whom 234 people are in hospital, 69 of whom are in critical care or ICU. And we have approximately 6,900 people under active public health monitoring, and 605 people are now recovered. Again, over this weekend, we've had 13 new deaths from COVID-19, bringing the total number of people who have died from this virus in our province to 1,259. our condolences go out to those families and caregivers and communities who have lost loved ones again this weekend. We have 2 new healthcare outbreaks, both in acute care hospitals, one at the Abbotsford Regional Hospital and the other at Dawson Creek District Hospital. And 4 outbreaks have been declared over at Evergreen Baptist Care Centre, the Hilltop House, Mount St. Joseph Hospital, and the Nanaimo Regional General Hospital outbreaks. That leaves us with 22 active outbreaks in long-term care or assisted living and 9 in acute care, involving 786 residents and 441 staff. Since the start of our immunization program for COVID-19, 154,496 people have received a vaccine, and of those, 12,111 are people who have received 2 doses. Each week this month, our available supply will increase, and we are looking forward to early in March when we anticipate being able to fully start our mass vaccination clinics around the province, and we are planning for that and for the rollout of this phase now. For those people who are in that group that we are going to be getting to as soon as we can, people who are over age 80 in our community, in the coming days and weeks, you will receive the information you need to know where your clinic will be or how you will receive vaccine. We're working on the details in every community across the province, and they will become clear in the next little while, and there'll be multiple ways that we'll be contacting people. And just to update you on adverse events, we've had 217 reports of adverse events following immunization since the start of the program. 18 of those were anaphylaxis or severe allergic reactions, and we continue to closely monitor and track for these events, as our national and international partners do as well. And we are watching what is happening around the world so that we can be reassured of the safety of the vaccines here in British Columbia. As well, as we talked about last week, we are watching very closely for the further spread of what we call variants of concern here in British Columbia. We're now, to date, have 40 confirmed cases of the 2 of the variants of concern here in BC, and that's 25 confirmed cases of the B117 variant that was originally found in the UK. Of those cases, 15 are in the Fraser Health Region, 5 are in the Vancouver Coastal Health Region, 4 are here on the Island Health Region, and 1 is a person who resides in the Interior Health Region. All of the cases, most of the cases of this variant are related to either directly related to travel or contact with somebody who's traveled. We have 1 case that we have not yet found a connection. We additionally are up to 15 people now who've been confirmed to have the B1351 variant, which was initially identified in South Africa. 13 of these 15 cases are in the Vancouver Coastal Health Region and 2 in the Fraser Health Region. And concerning for us, and we're still investigating, is how particularly 4 people from that group of 15 where we are unclear where they have contracted the virus and the variant. Of the 40 confirmed cases, though, I will say we only have 3 that are currently active, and Public Health has done extensive follow-up and tracing back of all of our cases, and the ones we know about, we are confident for the majority of them that there has been no onward transmission. Every day that we stop spread of this virus, no matter what the variant, we buy ourselves time. Time to get our immunization program up and running again, as we're going to be this week, and also time to better understand where we are seeing transmission and cases of this variant virus, these variants of concern in our communities. We are also closely monitoring our progress in this COVID-19 pandemic, and our intent is to ease the restrictions that we have in place as soon as it is safe to do so. We want to have that confidence that as we open up more, as we have more social connections, we do not have to step back again. I'm monitoring for a number of things. Fewer cases in our communities, fewer outbreaks or unchecked transmission in places around the province. These are important signs that we are ready. Also, having a better understanding of where the variants of concern are and how they're getting into our community. We are on track, and that is why it is so important for all of us to continue doing what we're doing and not throw away the progress that we have made. Our focus right now is to clear our path of those hurdles so that we can ease the restrictions as soon as possible. I will say this past weekend, WorkSafe BC and our public health environmental health teams were out again conducting spot checks and monitoring to make sure that we can support people in all places to follow COVID safety plans and keep everyone safe. And I do want to say thank you to everyone who stayed home with their families and watched the Super Bowl or went out with their close group to the restaurant sector. And I want to say thank you to that sector, to our restaurants, our food and beverage sector, and the people who were there this weekend for doing your part this weekend to help us continue to flatten our curve and support people to watch the game in a safe way. As we have seen, the choices we make today, as well as the plans we make for tomorrow, make a difference. And just as you did this past weekend, I'm asking everyone to do the same with our upcoming Family Day weekend. We all need to stay local and not travel unless it is required for work or medical reasons. I understand and know the many sacrifices that people continue to make, and I know that limiting travel impacts our tourism sector across the province. So I'm calling on everyone to support our local tourism sector. Be a tourist in your hometown, in your community this weekend. Book a night at your local hotel with your family. Order dinner from a favorite restaurant. Do takeaway. Or go outside and explore. Being outside with those that we are close to, with those we care for, is safer than being inside. So this weekend, connect and go for a walk with somebody that you're close with. Or go sit outside and have a talk. By avoiding travel now, we'll have much more to enjoy and many more places to visit in the weeks ahead once we get this pandemic under control. So let's continue to push our curve down by staying small, staying local, and using all of the things that we know protect us, no matter what the variant we're dealing with. And that means cleaning our hands regularly, staying home when we're ill, making sure that we get tested if we have any concerns about having the virus, making sure we keep our safe distances, whether outside or inside, and of course, wearing masks when we're in those common public areas. These efforts will make sure that once we have the protections we need, we'll be able to see our friends again. We'll be able to hug our grandparents and enjoy all that is spectacular in our province. We have the confidence knowing that it won't put our friends and family and loved ones at risk. We know that this virus transmits to those we are closest to. So let's do our part now to keep us all safe so that we can start to ease these restrictions as soon as possible. And of course, let's always remember to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry. I wanted to, on behalf of myself, of the government, I think of people in BC, pass on my condolences to the families, friends, and caregivers of the 13 people who passed away this weekend from COVID-19 in British Columbia, 9 from Friday to Saturday, 3 from Saturday to Sunday, and 1 from Sunday to today. It is, at this time, as it has been throughout the pandemic, a very difficult time to suffer loss. And we want to know, in each and every case, we are thinking of all of the families involved, of all of the people involved, all the people who've suffered loss as they grieve today, and we give them all of our support. I think It's evident today from the numbers with 234 people in the hospitals. This is an improvement from what we saw at the beginning of January when we reached about I think its height, about 381 people hospitalized with COVID-19 in BC. It's 234 today. And that leaves us, in terms of our capacity, utilization of our base beds in our hospital system at 88.7%, meaning there's 1,063 base beds empty and available. And when you add the surge beds into that, our level of occupancy is 70.4%, leaving 3,530 beds available. In terms of critical care, our current capacity of base beds is 73.3%, leaving 142 beds available. And our overall level, when you add critical care surge beds, is 52%, leaving 223 beds available. That's the situation that we're facing in acute care. As you know, there are still significant outbreaks in some acute care hospitals, and our staff continues to be under significant pressure. The fact that there are available beds does not mean that the situation is not extraordinarily difficult in acute care, and we remain appreciative of healthcare workers, of nurses, of health sciences professionals, and of course of doctors for all the work that they're doing in our acute care sector. Just wanted to note today, as we usually do on Monday, to report on an update on PPE. Over the past week, the following PPE has arrived in BC. That's 237,795 or equivalent respirators, 36,000 surgical or procedure masks, 151,466 pieces of eye protection, and 7,139,400 pairs of gloves, as well as 526,910 gowns. That's the update on that. I wanted to note in particular, as we see the immunization campaign that is on with 54,496 shots delivered, 146 vaccines delivered, 142,385 people in terms of their first shot, and 12,111 second shots in BC, and that's a significant achievement. And obviously, in long-term care, we're now down to 19 long-term care outbreaks and 1 outbreak in independent living. As you'll remember, on January 15th, that number, when added long-term care, assisted living, and independent living, was 49. That is, to say the least, a considerable achievement and improvement of the situation. We recognize that the pandemic continues to be difficult on people, and there is urgency to provide effective treatments for COVID-19. We are pleased to note that a $1 million donation from BC's own biotech company, Abcellera. With that, a clinical trial will take place within the Fraser Health region at Surrey Memorial Hospital of bamlanivimab. Bamlanivimab is, of course, produced by Eli Lilly, but receives an important license from Abcellera, and is, I think, a demonstration of the extraordinary work done in BC's life sciences sector. We welcome more evidence to improve care and look forward to more data on this and other therapies to combat COVID-19. As you know, because you will have heard of this, bamlanivimab is a synthetic monoclonal antibody made in BC, derived from the plasma of human survivors of COVID-19, and early phase 2 data have identified it as a priority drug for research, with the potential to reduce hospitalizations from COVID-19. And you'll be hearing more about this in the coming weeks as operational and clinical leaders are coming together to determine overall costing and operational needs, as well as to validate the study design. This is the normal practice. We will obviously have more announcements. I know Fraser Health, and I'm sure Abcellera will have more announcements in the coming days or weeks. I just want to say finally that in the COVID-19 pandemic, that our core skills remain the same. Frequent hand washing, physical distancing, mask wearing, no gathering, sticking to our household, staying home when we're sick. But as the modeling showed last week, when we increase the intensity of our collective use of those skills, when we adapt the public health guidance and orders aimed at supporting their effectiveness in stopping the spread, we make the difference. The message is simple. COVID-19 evolves and changes to spread. We adapt and get stronger to save lives. So that's our commitment, especially for the next few weeks, and we need to be all in on it. As COVID fights for new life, we need to fight, adapt, and stop the spread. That's our way through these next few weeks, and that's how we'll get through them safely, giving vaccines the best chance of success. Fight, adapt, stop the spread. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 5 et 6 février, celle du 6 et 7 février et celle du 7 février jusqu'au 8 février en mi-journée. Il y a eu 13 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 1259 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 428 nouveaux cas. Pour la deuxième période de référence, nous avons eu 465 cas. Au cours des dernières 24 heures, 343 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 234 personnes sont actuellement hospitalisées, dont 69 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You will be limited to 1 question and 1 follow-up only. I would also ask that you please take your phones off mute. You are not audible until your name is called. First question this afternoon is from Binder Sajan, CTV.
Hi there. Dr. Henry, with regards to the variants and the sequencing, I understand that takes a while to detect the variants. So do you have sort of I know it's not exact science, but a best guess about how many cases might be out there right now? I know you don't know where some of the cases are coming from, but I'm also wondering if you're able to tell us if they have resulted in more serious or more mild symptoms.
Yeah, so a couple of things that we're learning. So we are following each of these, and as you say, there's a delay, and that's why most of the cases that we've identified so far are no longer in their active phase or are very near the end of that period of time. So yes, we do follow very carefully and try and trace back and figure out where they're from. What we're also finding is it tends to be a younger population. So these are people who have traveled or have been in contact with people who have traveled for the most part. So we aren't seeing severe illness in the number that we've identified so far. Nobody has been hospitalized out of these cases. There has been some transmission within close contacts and particularly within households, and I was on calls this weekend with my counterparts across the country, and we're seeing the same thing, that there are it seems to be transmitted very easily in some particularly the variants associated with the UK in what we would people who were supposedly isolating at home. So we are paying more attention to that and determining, we were talking again with my colleagues in public health on the front lines about how do we manage this. And as you know, last week we did additional testing of people in a school environment to make sure that there was no transmission in that environment, and thankfully there wasn't. But the other thing that we need to do to help understand, you know, how representative these number of cases is, and get a sense of how many people there are in our community that have these variants of concern, is to do what we call a point prevalence study. That's similar to what Ontario did, where they tested, they ran a screening test and did whole genome sequencing on a whole day's worth of tests. So BC CDC lab, Dr. Pristjecki and Dr. Krajan are working on the process to do that, and we will be doing that as well, so that we do have a better understanding of, are we catching people, or is there more out there that we're missing?
Binder, do you have a follow-up?
I do. And speaking of your public health colleagues, Dr. Davila in Toronto was talking this morning and saying that in Toronto, they're in a transition now from one pandemic to a new one. So suggesting that the variants won't just lead to another wave, but sort of a more serious situation. And I'm just wondering, do you agree with that type of terminology, that it would be like dealing, if these variants were to come here, it would be like dealing with a new pandemic?
Sadly, yes. We've been talking about that a lot, and what we have seen in places around the world, in the UK, Ireland, Portugal, some other countries in Europe, and South Africa is a good example as well, that it does change the game in some ways if it starts to take off and become dominant in the community. And I think all of us are dreading that. We've all been through this, and it's been over a year that we've been doing this, and it really takes us back to some of the ways we were trying to manage the pandemic in January and February of last year, where we were doing case management and contact tracing and controlling every single case. And right now we need to take actions and figure out, how do we find places, people in the community, how do we assess how many cases we have, how much of a risk it is. And what they're finding in Ontario is that some parts of Ontario, it is spreading quite widely, and it's having impacts that we saw that were quite devastating in long-term care homes in particular. So we need to get a handle on it, and this is one of the main reasons why we are extending the restrictions that we have here in BC. And I'm appealing to people to take notice again. We are all tired of this, but it can lead us into a brand new charge of increased numbers of cases if we don't keep doing what we're doing. And I think people in BC recognize that, and we need to continue to make sure we're stopping those chains of transmission. And for businesses that are open, of which we have many in BC, that we have found that balance of keeping businesses open, we need, again, to go back to your COVID safety plans. And you must have one. That is the law. It must be publicly available. Workers must know how to get it. And we need to pay attention to those areas within each of our workplaces, no matter what they are, where transmission is happening. And WorkSafe will be working with you as well, and we'll be doing more testing, more surveillance and inspections, and our public health teams will as well. We know that when we follow the COVID safety plans, they work, and it keeps your staff safe and it keeps customers safe. So those are the things we need to focus on. We don't need to change the way that we're dealing with this, but we need to take notice, because if it starts to spread very quickly again, we need to put in place measures that would restrict our contacts again. So this is the period of time where we are trying to understand what's happening and make sure that we're doing all we can to stop it from taking off again.
Next question is from Richard Sussman, Global News.
Minister Dix did such a good job pronouncing that drug that I will not try to pronounce, created by Abcelera. I'm just wondering why the province believes that there should be more trials, considering there has been global trials done, more than 100,000 doses have been used in the United States, and there's a need for it now in British Columbia. Why the delay, and why is it not being used in the province now?
Yeah, so bamlanivimab, Richard. We have very early on here in BC and other parts of the country as well, we created a clinical reference group. And I created that group, and we targeted the people who are experts on this, on what therapies work for people both in the ICU and for people in the community. And that clinical reference group has been looking at the clinical care reference group has been looking at all of the treatments that have come out around the world from the very beginning, whether it's dexamethasone or remdesivir or hydroxychloroquine, all of the ones that we've seen more recently, bamlanivimab, and also colchicine recently in the last week. There was a paper out of Montreal. But those clinical trials have shown that there is still more understanding of who exactly this drug works best in. And the Clinical Care Reference Group has come up with a trial that will help us understand that. there is still not consensus among those experts, the clinical care, the people, the physicians who are actually treating patients about the benefits of bamlanivimab. Because the clinical trials were not cut and dried, and so they are setting up a trial. And I think the other thing to be really clear with this drug is that it's not just a poke in the arm. It's an hour-long infusion with a 2-hour period of time where you have to be observed, and it is you need to have it within a certain period of time of being tested positive. So the clinical trials are being set up. I know the ethics review has been put in already, because we need to be able to say to people, this is the risks versus benefits of this drug, and do you consent to be part of understanding how it might work best? So that's what's going on right now. I'm really confident that this is going to happen. I know the timeline is for later this month and 1st of March. So I think it's going to add to the literature of what we know about who it works best in, and that will make sure that we know how to use it properly going forward.
Follow up, Richard?
As well from Eli Lilly, is they're no longer going to be doing placebo-based trials. They have made the decision that they believe holding back treatment is something that could cause harm and even death, and won't do it. So how will these trials work if not placebo-based, and are you concerned about the company taking that stance?
No, the clinicians who do this for a living are working that out, and I have confidence. I've seen the early proposal that they have, and it's about who gets selected for the trial and what do you monitor and what is the ethical protocol that's being followed. So I have confidence that they're coming up with a reasonable approach for who should get this. And clinical trials, randomized controlled clinical trials with placebos are for those period of times where we have equipoise. We don't know if it's good or if there's benefits outweigh the risks and vice versa. So we are a little bit tipped towards the people that should use this drug, but the trials were not 100%, and it really only worked best when it was in combination with another antiviral. So I'm leaving it to the clinical experts to put together the trial that needs to answer that question, and they're in the process of doing that now.
Marcella Bernardo, News 1130.
I didn't hear you mention at all today the situation at Whistler. I'm hoping you can give us an update on what the numbers are like there and what concern or what's being done to try to keep the numbers from going up there.
Sure. So we've been talking with them and with all of the Western ski hills, and we'll have some more information about the things that they're doing. But there was a concerted campaign again this weekend to educate people about what's going on up there. We are seeing a slowing in the numbers of cases, which is good news. There is still transmission happening, and I know there was quite an impact from what WorkSafe and the environmental health officers did with a number of the restaurants, bars, and retail outlets, etc. last weekend. So from what we hear, it was a reasonable weekend. There are still long lines waiting for the ski hill, the lifts to the ski hill. That's something that is challenging for people, and I think there's more that still needs to be done to engage with the community so that for the next number of weeks of the season, there's a reasonable approach. Did you want to add to it?
Oh, I think that's good.
Follow up, Marcella?
I do have a follow-up to that, but my other question is for Minister Dix regarding pandemic pay. We're still hearing from people that have not received their pandemic pay, and just if somebody could give us the Whistler numbers, because I've tried to check with Vancouver Coastal Health and they haven't been able to give me an updated number as to how many cases have been recorded at Whistler since last week.
So we can get you an update on the Whistler numbers, I think, this afternoon, and what I'll try and do, maybe we'll put it out on social media so that everyone can get it at the same time, if that works well. With respect to pandemic pay, about 203,000 people have now received their pandemic pay. It was obviously simpler to do in the direct employment sectors, either of health authorities or other frontline workers than in some others, but a lot of progress has been made. I'm informed today by the Ministry of Finance that all the issues and all the cases should be resolved within the next 2 to 3 weeks. It's been estimated that a further 10 to 15,000 people may still qualify and need to receive their pandemic pay, and while we'd agree that's too long, 203,000 have received it, and I think that what we're seeing are positive steps forward, and I just want to take the opportunity to express my appreciation again to everybody on the front lines in the fight against COVID-19, everyone who's been working with people in these difficult times, and express my appreciation to them, and say that our expectation is that the pandemic pay question will be resolved shortly. And at the moment, it's about 203,000 done, and about, we believe, and we're estimating here, about 10 to 15,000 to go.
Next question is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Could we get a comment from you, your preliminary assessment, please, of this story out of South Africa and out of the UK about some concerns about AstraZeneca not being particularly effective against mild to moderate COVID illness? I believe the South African government has suspended use of it right now, and I see in the UK they're saying that problem with these variants may mean that herd immunity is not a realistic target. We may just simply have to learn to live with COVID-19.
Yeah, so these are things we're obviously watching very carefully. The AstraZeneca vaccine has submitted for a notice of compliance with Health Canada, and they are continuing to review and revise, and we expect that it will be approved for use at some point in the coming weeks. The other part of it, though, is what we're seeing with countries around the world. So the European Medicine Agency, the EMEA, which approves drugs for use in Europe, approved AstraZeneca last week, but different countries have chosen to take different restrictions. So in Germany, for example, it's only approved for use in adults from 18 to I believe it's 55 or 60. And a number of other countries are doing the same thing. I think there's 9 or 10 now around the world that have restricted it to use in adults. And part of the reason is we know that the messenger RNA vaccines, the Pfizer and Moderna vaccines, work really well in older people. And we have less data to support whether the AstraZeneca vaccine works as well in older people. It does seem to work in younger people, and there's but the data is not simple. There were a number of different trials that were done, including in South Africa. So yes, we've heard that it does not work as well, particularly for mild or moderate illness. It does seem to have effects, some benefit for hospitalization and more severe illness, but particularly in younger people. But the South African variant does make that concerning. There was also worries that both the messenger RNAs would have to be adjusted, particularly for the South African variant. The one in the UK, most of these vaccines seem to be very effective against. So I know there's data being shared with our National Advisory Committee on Immunization, who makes those decisions for Canada on who the vaccine should be used in, and we're watching that, of course, very carefully, which goes back to the whole thinking that we have right now, is that we need to understand these variants in our communities and how they're spreading and who they're spreading in, and control them as best we can so that we do have effective immunization programs if and when we get the vaccine, and it's starting to come again, as quickly as possible. I will also say that, we've also been watching what's happening in the UK with the use of the AstraZeneca vaccine, and it does seem to be very effective in preventing most illness, particularly in younger people, but they're using it as well in older people. So this is something we'll continue to watch. I know there's data being discussed even today with NACI in more detail, and I don't have the access to that yet, but yes, it's very concerning that South Africa is taking a pause on it. I'm also really interested in seeing the results out of India, where they're using the same vaccine in large numbers. So those are all things that we're working through the Public Health Agency of Canada and our National Advisory Committee on Immunization to better understand.
Follow-up, Glenn?
Yes, please. 2 weeks ago in the briefing, you'd identified 8 cases of the variants of concern. I believe that was the number. We're up to 40 now in 2 weeks. Given that rate of increase, are you confident we'll be able to keep it out of British Columbia? Are there sufficient precautions being taken to make sure that doesn't happen?
Yeah, that is the question. And, you know, this is in the face of increased testing as well. So we're doing quite a lot of testing and whole genome sequencing, which, as we said, is delayed. So some of these cases are people we've identified recently. The fact that we are reducing the number of people coming into the country and coming into the province with the international restrictions that have been put in place, and why we are so focused on people not moving around right now, because we know that the way the virus spreads is by us taking it to other places and spreading it to those that we're close to, and bringing back risk from the places we go when we travel. So one of the reasons that is something that is important right now is so that we don't give this virus legs, or these variants legs, to spread rapidly while we're still in the process of expanding our surveillance and getting a better understanding of how much is there. I've said this last week and I say it again, the strategy that we have through the BC CDC makes me confident that it's not widespread, and the testing that we've been doing in like the school last week, for example, in some of the outbreaks that we've had in the acute care sector, in some of our shelters, and some of the First Nations community outbreaks, we've specifically tested those to see if they're being caused by this variant, and so far they have not been. So those are the things that give me confidence that it's not yet spreading widely. But that can happen very quickly, and we've seen the modeling studies that show if we don't continue to keep a hold on and prevent those long chains of transmission, that it can very rapidly increase. And I know the study from Dr. Cochin at SFU suggested that we do not seem to have had early seeding of the population with these variants. So we're looking at a time frame into March, that if we can keep control over it for these next few weeks, we can push that out until we have more people protected through immunization.
Next question is from, where am I? Glenn Korstrom, Business of Vancouver.
Hey, yeah, thanks for taking my question. Just wondering also about the vaccine rollout and Canadian disruptions and shortages. As we scale up for wider distribution in April, do you expect disruptions to continue, or do you expect logistics to improve and smooth out?
So I think we are hoping for the latter and planning for the former. So yes, we know there's glitches all the time when you mass produce a vaccine like this, especially a new one with the new formulations, that can lead to problems. The things that they have done to scale up at the factory level, so what they were doing with the Pfizer and Moderna factories, the fact that other vaccine manufacturers have taken on, have stopped some of the trials that weren't going very well and are pivoting to be able to manufacture more of the Pfizer vaccine, for example. And Moderna is retooling to be able to get more doses per vial is one of the things they're looking at. So those are all things that I think it surprised everybody, including the manufacturers, that these vaccines were approved so soon. And partly that was because the clinical trials were very compressed and we had so much transmission of virus that they ended rapidly. So these are growing pains that we would expect. I am hopeful by April that things will be much smoother. At least we'll understand where any more issues are. But there's always going to be problems when you're moving large numbers of a product to different parts of the country, to remote communities, to large communities, and distributing it widely through to many, many people. There's always going to be glitches, and that's what we're working to. And Dr. Penny Ballum has taken that on and has a team that's working to make sure that once it gets into BC, we're able to use it as most efficiently and as effectively as possible.
Glenn, do you have a follow-up?
Sure. On the variants, one that I didn't hear you mention today was the Brazilian one, which I believe Ontario registered its first case of. How serious do you consider the Brazilian variant versus the other two? Any comments on that virus or variant?
So there's that one, and there's, as we talked about last week, there's a number from the U.S., particularly from California, from L.A. area that we're watching. But all of them have markers, and there's some specific features of each of them that are quite similar. So we are looking for all of those, and we're looking for the 501Y particularly because it is one of the mutations that's been associated with this increased transmission or transmissibility of the variants, and that's one thing that is in a number of these different variants of concern. So again, we have a whole lot of genetic mutations, and if you remember the phylogenetic tree we showed on Friday, that tells all the different cousins or relative variants that we found in BC, but not all of them confer an advantage to that strain of the virus. And so the variants of concern are the ones that we know are associated with increased transmission, and we're watching for all of them. We have not found any of the variant associated with Brazil here in BC yet, but we are definitely looking for it.
Next question is from Cindy Harnett, Times Colonist.
Oh, thank you for that. The Health Ministry policy regarding visits to long-term care homes was put in an order on Friday, and I was wondering if you could tell me why that was done and what you hope it will resolve. I'm imagining that people weren't getting their essential visits or social visits.
Yeah, so that was a provincial order, a public health, provincial health officer order that basically gave a common order for the entire province. And it is something because when we initially put in restrictions on visitations early on, it was done by each of the chief medical health officers in the regions, and there was a little bit of variation in what those orders said. And in some areas, because they didn't have any long-term care outbreaks until very recently, they had not put in an order. So this is to make it consistent around the province and to make sure, and we've put in the definitions of what an essential visitor is, as opposed to a designated or social visitor, which is a different, and the fact that people can have an essential visitor if it's needed, plus a social or designated visitor as well. So we are trying to clarify things to make sure it's consistent, and one of the complaints that we've heard repeatedly is inconsistency in how the guidelines have been applied around the province. So the order and the guidelines are being revised to make sure that everybody understands what the definitions are, what the expectations are, and that it be consistently implemented. The other part that's part of the order that we wanted to clarify was the process that people had to get a review of a decision made by a facility. So we're trying to make sure that that process is again consistent across the province, because that's one of the biggest challenges that we've heard from the many different care homes that we have around the province.
Did you have a follow-up?
Oh, I do. Thank you. So, further to that, then, Ombudsperson CHEK has said that it should go one further, that there should be mandatory timelines, written decisions for those that appeal process for the visits, and better communication of the policies. Is that something you agree with?
Yes, and I want to thank the Ombudsperson, Mr. Chalk, for his advice on how we do this in a way that meets the needs of people, because he's hearing about people's concerns as well. So we've been working together to try and make sure we have a consistent process, and those were two areas that he identified that in people's concerns that were brought up to him that he thinks we need to do better. So we are, what we'll be looking at, and we've heard feedback feedback from operators that it's sometimes challenging for the administrator who's there to give somebody a written reason. So what we'll be looking at is, can we provide people with templates that they can use to understand, so that we're clear that everybody knows what essential is and why somebody is not or is not deemed an essential visitor, and that will put the timelines, make them more explicit for people. So yes, I absolutely agree, and we're working on that.
Prabhat Sohal, Red FM.
Good afternoon, Dr. Henry. My question is regarding the Abcellera and Eli Lilly drug. The recent results of the Phase 3 Blaze 2 trial show that the drug is also efficient in preventing severe outcomes of COVID-19 and not just helping in treatment. So is the trial also testing the drug's prophylactic properties, or is it just to see how it works in the treatment? And secondly, when this trial is being conducted, are the variants also being studied?
Yeah, so a couple of things around that. Yes. No, it is not being studied as a prophylaxis, so something that prevents transmission after exposure. There was some limited data that suggested that might be in long-term care homes, but now, of course, with immunization programs in long-term care, it's a bit of a moot point. So we don't have the ability to study it in long-term care. Again, the data was not clear-cut, so it does need to be investigated a little bit more. So it is focusing on early treatment of people who are likely or more likely or at risk to develop severe illness, end up in hospital. And as you can say, it has to be within a certain period of time of being diagnosed with the disease for it to work. And this is one of the concerns. We will be, I am sure, part of the trial will be ensuring we know what strain the person is infected with, because there has been evidence from around the world that these monoclonal antibodies don't work as well on some of the variants, particularly the South African variant, but also concerns about their benefit in the UK variant. So that'll be part of it for sure. I think it's a very important thing to understand, where it's working or not working.
Prabhat, do you have a follow-up?
Yes, and in case there is an approval for this drug, and it was mentioned earlier that there are logistical issues, and you mentioned it today as well, that the person has to be given a 2-hour-long IV. So what kind of situations do you think it might be easier to use this drug? Are you looking at long-term care or any specific area where you can use this?
Yeah, so the idea is to use it in people in the community, and let's just be clear, it is approved for use by Health Canada, and BC has an allocation of it's got an emergency approval for use by Health Canada, so that means that we can use it in the public health emergency, and the clinicians here in BC felt that they needed to better understand who it works best in. So the idea is to use it for people in the community who have been diagnosed with COVID-19, who have risk factors for ending up in hospital or having severe illness. So it will be through an outpatient clinic associated with Surrey Memorial Hospital to start. But I know the clinicians are looking at where else in the community you could do that. But as you say, it's not something that you can do just in a physician's office. It takes a very specialized type of environment to give an infusion over a period of an hour and then the monitoring period. So there are absolutely mostly some of the ambulatory clinics that are associated with hospitals where that can happen, and I know they're looking at how to do that best.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for more about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Tina Lovegreen, CBC. Tina, are you there? Okay, we will go to Jane Sy. Oh, Tina, are you there?
Hello?
Go ahead.
This is Tina. Can you hear me?
Yep.
I'm so sorry. Okay, sorry, Dr. Henry. This is about vaccines. More than 154,000 people have received their first dose of the vaccine, but just over 12,000 have received their second. And considering the vaccine supply delays we are experiencing, are people getting their second dose within the 42-day window at this point, or are they waiting longer than that?
So most people are within the 42-day window. Some of us are waiting because the data continues to accumulate about what the optimal dosing interval is. We're watching what's happening in Quebec and in the UK, as I mentioned earlier, where they have delayed the interval for 90 days. And whether, so what we need to learn from that is, how high do the antibody levels go, how protective are they, and how long do they last? And right now, what we're seeing from the UK, what we're hearing from Quebec, though I haven't seen all of the data yet, and I know our National Advisory Committee on Immunization is working on that, but we have seen good, strong response that lasts for at least the 42 days, and so I have no concerns that if we are delayed because of the vaccine supply, that we will be putting anybody at risk. We've seen very high levels of antibodies develop within a very short period of time, and the data that we're seeing around the world confirms that. So it's not like a medication where it's out of your system and it no longer works. When you receive a vaccine, it stimulates several parts of your immune system. One of the ones that we measure is how many antibodies that we produce. And those antibody levels go up after about 10 to 14 days, and that's what we've seen from both of the messenger RNA vaccines, the Moderna and the Pfizer vaccines, and it goes up very rapidly, and then it levels off. And when you get the booster dose, whenever you get it, those antibodies go up again, and then they level off again. And what we've seen is that the vaccine is very effective at about day 21, so 3 weeks after receiving your first dose. People are, the prevention of illness is in the 90% range. And when you get your booster dose, that bumps it up to as high as 94, 95%. So we are very confident, and we're getting more and more data as the vaccines are being used, that people are protected at least up until 6 weeks and probably quite a bit longer. And we also know from every other vaccine that we have that if you increase the interval between the priming dose and the booster dose, that allows the immune system, your cell-mediated immunity, to develop a more robust response as well, and that you often get a more robust and a longer lasting boosting effect if you wait a bit longer. And we've seen that with the study in the AstraZeneca vaccine in particular, that the vaccine effectiveness, how well it protected people, was higher if you waited a bit longer before getting the second dose. So those are all the things that we're considering right now. And particularly with the AstraZeneca vaccine maybe coming online in Canada soon. And I think the other thing that's really intriguing is that we're getting more data, particularly from the UK, that's starting a clinical trial, started this week, about mixing and matching. Does your immune system respond better if you get a dose of one vaccine first and then the second, a different vaccine as a booster dose? So if you get the AstraZeneca first, is it better to get the messenger RNA vaccines as the booster, and does that give you better protection or not? So those are some of the really interesting questions that we have all been thinking about since these vaccines became available, particularly the new technologies and trying to understand how they best will protect us in the long term. And I'm really excited to see what comes out of the study in the UK that started now. It shouldn't take too long to understand that a little better.
Tina, do you have a follow-up?
Yes, please. Hoping you can still hear me. Dr. Henry, you alluded to this earlier, but with restrictions being extended with a possibility to loosen them if the number of cases remain low, do you fear there will be a rise in cases or even a third wave if the restrictions are lifted too soon? And if we could please get an answer in French as well.
Yes, and I think we're all concerned about that. You know, we look at where we are, and we know that the lower you start from, the better chance you have to stop things if they start to spiral again. So public health is working. We're back doing those things that we need to do rapidly. That's contact, case management, finding people, isolating them, finding their contacts, contact tracing, isolating those people. And as you can imagine, after a year, people are getting tired of that too. So we are reinvigorating our public health teams to manage that. It is the thing that we do, and that we do to manage outbreaks, to manage clusters, to manage cases. And we have a strong teams now that are experienced in doing this, and we're going back to basics with the concern about variants. So yes, we're watching very carefully. We are sort of slowly coming down. We're still in the 400 cases a day, which is a lot, and it's a lot in some areas of the province. And we know if we start mixing again, if we start coming together again, if we start moving around in the province, that can take off. So that's our biggest concern right now, and the reason why we have kept the restrictions as they are. As you know, we have never gone to some of the very hard lockdown restrictions that they've had in other provinces. And we've managed to keep that balance. And now more than ever, it's really critical that we keep that balance, that we keep children in school safely, that we keep our workplaces and our shops open and in a way that's safe, so that we can and keep our health system protected. And so far we're doing a good job, and that's exactly why we're keeping the restrictions that we have in place. And if we get to that low enough level, as soon as we get there, there are some things that we need to do, and that involves youth sports, it involves religious services and faith services, it involves us being able to expand our social connections in a limited way again, and that's what I'm looking forward to as soon as we can.
Effectivement, nous avons toujours préconisé une démarche mesurée, équilibrée en Colombie-Britannique, mais bien entendu, on craint toujours que ce soit une deuxième vague ou une troisième vague, on le craint, et donc il faut continuer de suivre les conseils et les ordres de la santé publique actuellement, plus qu'avant, parce qu'on a des vaccins, mais les vaccins ne sont pas très nombreux maintenant. Ça va changer, mais pour le moment, c'est une situation sérieuse. Donc, il faut continuer de convaincre, continuer de suivre, nous tous, les conseils de la santé publique, et c'est plus important que jamais. On sait que des gens sont fatigués, ça c'est évident. Ça fait 1 an et je pense que tout le monde veut que ça cesse, mais ce n'est pas notre choix. Le virus a ses propres idées, et ces idées sont liées toujours à la transmission. Il y a toujours des nouveaux défis, et maintenant il faut continuer de nous protéger contre la transmission de COVID-19. C'est surtout important pendant ce mois de février, le mois de mars, de continuer de le faire. Donc, les mesures, bien entendu, continuent, mais on songe à une journée, j'espère dans pas si longtemps, qu'on peut changer cela et qu'on nous serons en mesure de nous rassembler un peu plus encore une fois. Merci beaucoup. Thank you very much. We'll see you later in the week.
Thank you for joining us.